How does smoking impact the lungs? Smoking adversely impacts lung function by destroying the surface area of the alveolar sacs of the lung, which inhibits its ability to absorb oxygen. Also, the elastic recoil, or the ability to exhale gas from the chest quickly, is diminished with years of smoking. But also, there's the obvious risk for lung cancer with smoking. What is EBUS? EBUS stands for endobronchial ultrasound, which is a form of bronchoscopy that utilizes a saline-tipped balloon in order to visualize mediastinal structures such as lymph nodes with sonography in order to biopsy. The bronchoscope is inserted through existing endotracheal tubing that's hooked up to a ventilator through a Y connection. The scope is driven down under real-time guidance on an observation screen. The scope is then parked in the region of interest, which is usually either the right distal mainstem bronchus or the left distal mainstem bronchus. The camera is switched to ultrasound mode. The balloon is inflated with normal saline, and you can see the structures by manipulating the bronchoscope with your wrist to look for tissues in order to biopsy. Typically, candidates for EBUS are people that have enlarged mediastinal lymph nodes. Typically, those are lung mass workups or lung cancer. How long does an EBUS take? Typically 20 to 30 minutes, depending on how many biopsies are done. It can extend even longer if there's multiple lymph nodes that need to be biopsied. Does EBUS require general anesthesia? EBUS does require general anesthesia because there can be no coughing or movement or agitation of the patient, which will inhibit the ability to visualize mediastinal structures and biopsy them. Is EBUS biopsy painful? No, there's no nerve tissue in the area of biopsy, and the patient is under general anesthesia, so they don't experience any pain. What can a patient expect during a sleep study? Our sleep lab here at Magnolia is fully accredited with the American Academy of Sleep Medicine. Basically, you arrive at the sleep lab at 8 o'clock at night. It takes about 45 minutes to have the surface electrodes hooked up to your body. Then you're asked to go to sleep when you're drowsy, and you're directly observed without a tech in the room until the morning when you awaken, typically around 6 a.m. Why should someone come to MRHC's sleep lab rather than an independent sleep center or a larger hospital? MRHC's sleep lab is fully accredited with the American Academy of Sleep Medicine, and we offer workup and treatment of all sleep disorders. So really, there is no need to go to a larger facility for your sleep needs. What is the difference between a CPAP and a BiPAP machine? They are similar. They are both used to treat sleep disorder breathing. However, a CPAP is a single set pressure. A BiPAP is a double pressure, which utilizes an inspiratory pressure, and then upon exhalation, an expiratory pressure. Inspiratory pressure is known as IPAP. Expiratory pressure is known as EPAP. Together, they're both known as BiPAP.